5 children and youth in Ontario struggle with mental health issues. Yet over half of these problems develop from childhood. Standing here today, I cannot help but think of the countless young people like myself feeling hopeless. Growing up, I've experienced firsthand what it's like to try and find support in a system that's overwhelming. Sure, according to the CMHO, there are over 4,000 professionals helping kids every day. But the reality is, Ontario's resources are inadequate to meet the demand. We are failing to address the youth mental health crisis due to long wait lists, a lack of funding and support, and a stark contrast to countries that prioritize early support and accessible services, which raises a question. Is Ontario truly addressing the youth mental health crisis? And how do we put an end to this, leaving many in Ontario silently struggling? Now, believe it or not, but one of the main causes that are inadequate to support our youth is long waiting times. And guess who's responsible for that? Ontario. Oddly enough, the CMHO reports that a whopping 28,000 children were on wait lists for mental health services. That's like an entire football stadium full of us begging for help. To make matters worse, some children were tragically waiting up to a heartbreaking 2 years for the treatment they needed. And the worst of all, the Canadian Mental Health Association argues that a staggering 200,000 youth with serious mental health problems have no contact with mental health services, yet alone having the time for support due to all of these delays. These unacceptable hindrances are a time-ticking bomb, and we must ensure that every young person has access to the mental health care that they deserve. Now consider the reality of a teenager struggling with their mental health, feeling lost, scared, and even alone. This was not a fictional scenario. This was a real-life story that was truly heartbreaking to read. Meet Vicky, an ordinary one. Just like yours, watching her son battle mental health problems. Vicky found that the support offered was often insufficient and didn't meet her family's specific needs, showing how the mental health system is under-resourced. When the pandemic hit, Vicky's son had to switch to virtual care, which completely turned the tables. Her son experienced online therapy as a hassle and worsened mental health problems, including suicidal thoughts and increased hospital visits. Vicky, most importantly, wanted an improved access to the mental health systems. As she puts it, our system needs more funding for services and better support for kids and families. But while Ontario grapples with long wait lists and underfunding, Sweden and Luxembourg serve as beacons of hope. According to the OECD, Sweden ranked #1 for mental health from 2023 to 2024, partly due to the Young Health Program, a mental health initiative for youth aged 10 to 24, and with citizens having 15 hours of free time daily. Seriously, with that much time, you could write a best-selling novel and still be bored, while Ontario's youth are still trying to get their first therapy session scheduled. Additionally, Sweden's public health agency helped over 29,000 children by promoting mental health and preventing illness among its entire population. Next, according to the WHO, Luxembourg has one of the world's best mental health care systems, spending over $6,400 per person. Luxembourg also covers all youth therapy costs and reimburses up to 70% for adults or anyone older, resulting in depression rates plummeting from 11% to a mere 5% in 2023. However, it is not just Ontario that is falling behind from other countries. Our entire country, Canada, is unable to keep up with the rest of the world in providing sufficient support for youth mental health. Did you know that suicide is the second leading cause of death among our youth? That is heartbreaking. On top of that, 1.25 million young Canadians need mental health support yearly. By embracing approaches such as Sweden's Young Health Program or Luxembourg's extraordinarily high spending, we can ensure that every Canadian child has the right to the mental health care that they deserve. We, as Canadians, are failing in addressing the youth mental health crisis. Why? Because of long wait lists, a lack of funding and support, and a system that does not prioritize the mental health of our youth. And when we compare this to countries like Sweden or Luxembourg, it is clear that we are falling short. So what do we do about it? The answer is simple. Our youth deserve better. We cannot let wait lists grow longer, or our system continue to be underfunded. Without the proper support, our youth will be unable to fully access education or employment, and their potential to contribute to the workforce or innovate for the future will be disrupted. You've probably heard this motto: the youth of today are the leaders of tomorrow. But are we really doing enough to set them up for success? Let us put an end to this chaos and create a system that truly supports the mental health of future generations.